Hello everyone, good afternoon, Miss. Before I start, allow me to introduce myself first. By the way, I am Hanami Aurelia, a nursing student from Mati Doctors College. Um, in this video, I'm going to discuss the nursing care of a family with an ill child. So, I am the reporter for the chapter 36. So, let's start with the key terms. First is the calorie counting, involves counting the number of calories that children ingest each day. So the amount of energy in an item of food or drink is measured in calories. So when we eat and drink more calories than we used to have, our body stored excess as body fat. So next is the non-rapid eye environment or the NREM sleep. This type of sleep occurs in up to 80% of total sleep time. So it involves light sleep from which you can be awakened easily. So stage N to last from about 30 to 60 minutes. During this stage, your muscles become more released and you may begin to have slower or delta brain activity. So NREM sleep helps your body wind down and fell into deep sleep. So next is the play therapy. Play therapy addresses basic and persistent psychological issues associated with how a child may interact with his or her world. So play therapy capitalizes on children's natural ability to express their feelings and resolve conflict through play. So when we say play is the work of children. It consists of those activities performed for self-amusement that have behavioral, social, and psychomotor rewards. So, during hospitalization, this play therapy can help for the children to dili nila mapansin ang pain na ginabati nila or dili nila dili sila makasing away sila from home. So, primary nursing. Next is primary nursing promotes ongoing communication between the patient, family, nurses, and physicians by building rapport and facilitating discharge planning beginning on admission. So next is the rapid eye or the REM sleep. Late adolescents have the least amount of this type of sleep. Yeah, this type of sleep. So this rapid eye movement sleep is the highest stage of sleep during which a person may wake easily. So the next is sensory deprivation is the condition of being deprived of or lacking adequate sensory, social, physical, or cognitive stimulation. So next is sleep deprivation. Children who do not receive enough sleep. Therapeutic play is play designed to help children express their feelings about painful or frightening procedures, and also play needs are different for each child. And let's proceed for the assessment for an ill child. Assessment for a child diagnosed with an illness that requires hospitalization begins with an interview of the child and parents to identify ways they think the illness will change their lives. And also it includes a wide range of situations such as increased expenses, changes in schedules to visit or stay with a hospitalized child, need for one parent to take and leave from work to care for an ill. So taking care of an ill child is one of the most draining and difficult task a parent can face. So beyond handling physical challenges and medical needs and the impact that a prolonged illness can have on the entire family. So it's important for a child to know that he or she is sick and will be getting lots of care. As I explain the illness and its treatment, give clear and honest answers to all questions in a way your child can understand. So as a parent or guardian, you need to explain further for your child or children that ano iyang ma-receive na pain during the treatment. So let's proceed for the assessment for an ill child. So assessment for a child diagnosed with an ill illness that requires hospitalization begins with an interview of the child and parents to identify ways they think the illness will change their lives. It includes also a wide range of situations such as increased expenses, changes in the schedules to visit or stay with the hospitalized child, need for one parent to take a leave from work to care for an ill. So, in taking care of a ill child is one of the most draining and difficult tasks a parent can face. So, beyond handling physical challenges and the medical needs and the impact that a prolonged illness can have on the entire family. So in this case also, it's important for a child to know that he or she is sick and will be getting lots of care as you explain the illness and its treatment. Kung you need, as a parent or guardian, you need to explain further kung unsa iyang ma-receive nga pain para ma-expect niya, dili siya mag-expect nga you need to explain further unsa iyang ma-receive nga treatment o unsa ang pain ani nga mahatag, and give clear and honest answers to all questions in a way your child can understand. And let's proceed for the nursing diagnosis. So, for the nursing diagnosis, those often with families of children seen in ambulatory and in hospital settings include, so first, the health-seeking behaviors related to lack of knowledge regarding illness and anxiety related to pending hospital admission, risk for social isolation related to hospitalization, fear related to being away from home for the first time, activity intolerance related to fatigue from illness, potential for intentional injury related to high-tech therapy equipment. So, for the outcome, next is the outcome identification and planning. And planning for the care of an ill child requires consideration of all aspects of the child and the family's life, financial, social, and personal. If child will need long-term care or hospitalization, the entire family may find their priorities changing. Identify interventions also is an important nursing role. So, planning for the care of an ill child requires consideration. If a child will need long-term care or hospitalization, the entire family may find their priorities changing. And helpful resources and support programs that address the needs for the ill child and their families are also available. So, let's proceed for the implementation. So, for the implementation, there are 5 hazards that may occur with children with all illness. These are the first, experiencing harm or injury such as physical discomfort, pain, mutilation, and death. And the second, being separated from routines, parents, peers, and respected adults, facing the unknown, new and strange sights and sounds and happenings. So, lahi ang environment diri ma-feel niya nga lahi ang environment diri facing uncertain limits and clear definition of acceptable and expected behavior during the hospitalization, experiencing a loss of control, loss of competence, or loss of the ability to make decisions. So, discussing these hazards with children based on their development age is important, so that implementations to reduce their impact can be tailored to each child. So, based on the child's developmental age, methods for assessing these potential concerns and introducing effective strategies to help the child cope may include reading to a child, role playing, and puppetry. So, let's proceed for the outcome evaluation. An evaluation of expected outcomes for ill child should include specific measures such as whether discomfort was kept to a minimum during the experience. So the following are examples that suggest achievement of outcomes regarding hospital experience. So first, parents state their level of anxiety regarding hospitalization of their infant is now at a tolerable level. So next, patients have effectively changed work schedules should be to be able to stay with their child in the hospital. Next, social isolation of a toddler is minimized through a case manager nursing assignment. So let's proceed to the meaning of illness to children. So let's proceed to the meaning of illness to children. So the response of children illness depends on their cognitive ability, past experiences, and level of knowledge. Early school age children generally know quite a bit about the workings of their major body parts, and also early grade school children are usually able to name the function of the heart, lungs, and stomach. And the fourth grade children are generally aware of the role germs play in illness, but may be fooled by thinking that all illnesses are caused by germs. So it depends upon their cognitive ability, past experiences, and the level of knowledge. Also, it involves providing emotional support as well. It's either the family should be well oriented also so that they can report or giving an intervention as early as possible. So for example, in terms of visit, it is one of the factor why the children needs a support person, and what you call that, recovers also could be more easier. So 8th grade children are able to voice an understanding that illnesses can occur from several causes, such as being susceptible to chickenpox because they did not get a vaccine. And lastly, all illnesses in a child is stress, especially if it includes hospitalization. So if the child is not yet matured, there's a lot of myth about the cause of illness in which they depend and believe on it, but then if they're getting matured, they are knowledgeable and aware of it. Also, we can recognize it as healthcare provider by identifying the signs and symptoms and giving what you call this desired interventions. Yes, it is stressful, most especially if the child is hospitalized, but since their health is our top priority, so we need to do that. So next is let's proceed to differences in response of children and adults to illness. So keeping in mind that children are not just small, adult is important when evaluating how children react to illness, perceive an illness, or react to healthcare. And also, they may have difficulty feeling which body parts are indispensable and which are not. So, inability to communicate. Children younger than 5 years of age have a great deal of difficulty describing a headache. A school age child who guards her abdomen or his abdomen, like keeps abdominal muscles rigid is in pain just as early as a child who verbalizes a source of discomfort. So they cannot rate their level of pain, cannot recognize symptoms, especially in 5 years of age. Example, masakitan og tiyan, then diyahang what do you call that, iyahang tiyan, then naghilak o ias nimo, then i-report niya nga sakit iyang tiyan, then big deal siya masyado sa atong sakit as healthcare provider. Yes, tama ba? Yeah. And then inability to monitor own care and manage fear. So adults who are ill often ask questions about medications prescribed for them or procedures they are scheduled to undergo. School age and younger children cannot monitor their own care this way because they may not know which medicine or procedure they are scheduled to receive. And school-age child and adolescent may be concerned about the loss of body parts, loss of life, and loss of friends. And about the adults have fears also, but most have prior experiences to draw from making coping easier. And syempre ang mga bata dili man sila kabalo mo tumar og tambal nga sila ra, kailangan na ay support person to perform ato. Aside ana, if the patient is na hospitalized, they consider the hospital as strange environment. So let's proceed to the nutritional needs. Children differ from adults in many ways. In addition to psychological differences, there are major physiologic differences in the way illnesses affect children compared with adults. So, for example, children need more nutrients, like calories, proteins, such as calories, protein, minerals, and vitamins per pound of body weight than adults. So, the child who must limit food intake because of nausea or vomiting, and it requires intravenous therapy if na hospitalized na child, hospitalized child patient. So let's proceed to the fluid and electrolyte balance. In adult extracellular water, the water held in plasma and outside body cells represents approximately 23% of total body water. So newborn extracellular water is closer to 48%. And this means that an infant does not have as much water stored in the cells as an adult, and so is more likely to lose a devastating amount of body water with diarrhea or vomiting. So next is the systemic response to illness. So let's proceed to the systemic response to illness. Child's body in continually growing young children tend to respond to disease systematically rather than locally. And systemic reactions of these kinds can delay diagnosis and therapy and can cause increased fluid and nutrient loss, the circumstances that compound the initial illness. And for the age-specific diseases, most adults have achieved immunity to common infectious diseases. Children, however, very susceptible to illnesses such as measles, mumps, and chickenpox. And for the care of ill child and family in the hospital, research has raised awareness about the psychological trauma children and their parents face when
when hospitalized. The caregivers of child admitted to an intensive care unit or the ICU, neonatal intensive care unit or the NICU, or general pediatric unit are likely to experience a high degree of stress of their child illness and the high-tech pediatric or the ICU or NICU setting. So importante pud nga aware sila sa buhaton to avoid contamination, and most especially if one of the one of the members of family is conscious or contagious ang sakit, og since bata ang kauban, it's important nga mulikay para dili magka tinak nanay. Yes. And for preparing for continuation, preparing for hospitalization involves disseminating developmentally appropriate information, facilitating communication, and developing trusting relationships with healthcare professionals. And also, depending on the age of the child, there may be anxiety if child is told about an approaching hospitalization too far in advance. And one day of hospital admission, it is important for you to ask the parents that preparation they may have done to ensure the child and family accurately understand the child's condition and upcoming procedures. So, for the effect of hospital separation, ang mga bata kay wala pa na-develop ilahang coping skills or mechanism. So, when we say in hospital setting, mas prone sa mga anxiety, especially magduha-duha sila report sa ilang na-feel, sa ilang feeling, kay maulaw sila sa nurse that anxiety may be establishing a primary nurse. So then next is admitting the ill child and family. Whether an ambulatory or inpatient hospital unit admission, children parents need to be admitted as a single entity to encourage parents to feel that they are true partners in care. All children should have an armband attached which lists their name, date of birth, and hospital medical record number. So, all children should have an armband, kanang binabutang siya dari kung makita niyo sa mga bata. And then next is assessment on admission. So, assess each child level of preparation for a hospitalization on admission. Also, beware of not only what the child describes verbally, but also note any facial expressions or nervous manifestation. So, parents upon hospital admission for a nursing history to information. So, such as patient illness history, muna siya. So, providing adequate play facilities, children need to be able play as much as possible, not only to aid in distraction but also to encourage emotional well-being. And so, let's proceed to providing adequate play facilities. Children need to be able to play as much as possible, not only to aid in distraction but also to encourage emotional well-being. So, ang mga bata, di ba, kay murag mas dili nila mapansin ng ilahang sakit or ilang pain nga na feel kay mas malingaw sila nga magdula ana. So but also to encourage emotional well-being. Yes. And nursing responsibilities for care of the ill child and family. Nursing responsibilities will vary naturally with the type, extent, and seriousness of a child's illness, age, care setting, and individual circumstances. And a number of responsibilities such as promotion of normal growth and developmental sleep, stimulation, and play are more global across all ages and phases of care and are discussed here. So, when promoting adequate sleep for the ill child, children who are recovering from trauma such as injury, such as injuries from a car accident or burns may be unable to sleep because of nightmares about the accident. Diba kanang once kanang ang mga bata is kanang maka-experience sila aksidente, kanang matrauma na sila ana, like for kanang sa car dili na sila dili na sila gusto mo sa kayo balik kay kanang na trauma na because they experience it already, and sa kanang maybe unable to sleep because of nightmares about the accident, mapanigit-nipan na nila ang nahitabo sa ilaha. So let's proceed to sleep patterns. The purpose of NREM sleep. The first phase of sleep is rest and restoration of the body. This stage keeps body cells functioning and healthy. And the purpose of rapid environment. REM sleep is less clear. The REMs may serve to coordinate binocular vision. So, promoting adequate stimulation for the ill child. Children are in constant interaction with both their internal environment, like body, and their external environment or surroundings by means of their 5 senses and the central nervous system. So, for the sleep deprivation, sleep deprivation is the condition of being deprived of or lacking adequate sensory, social, physical, or cognitive stimulation. Children with hearing or visual deficits are prone than others to sensory deprivation. So, children who do not receive enough sleep can suffer sleep deprivation, just as adults do. After approximately 4 days of poor sleep, this can cause them to experience difficulty in concentrating and episodes of disorientation and misperception. And the next, assessing child health through play. Children who are acutely ill do not play or play very little because they do not have the strength, the attention span of the interest in activities required for play. And then next is providing play in the hospital. So, ideally, all hospital units in which children are cared for should have a play space big enough for most of the unit to come to. School-aged children can play games and create objects which arts and crafts. Adolescents enjoy table tennis and pool tables. Like kanang good kanang shape nga dulaanan kanang i-shoot lang, like for example star, pangitaon niya ang shape pod nga star para ma-shoot dito mao na ilang mga hilig pod. So, providing play for children on bed rest. Children who are on bed rest at home or in a hospital need to have play periods built in their day para dili sila aburido. Kay labi na pagbag-ong mata, like sa tuwa kita na adult, dagko na always na to ginaingon magbiro ka sa lasing, wag lang sa bagong gising. So just like them, kanang bago silang mata kanang murag aburido sila, dili sila mo kanang mudawat sila in tao, like that. So child support programs such as child life services are incorporated into major children's hospitals and are integral feature of child health care. So for the therapeutic play, yes, children for therapeutic play, only the child's verbal cues are used as responses. Therapeutic play can be divided into 3 types. So first, energy play release, dramatic play, and creative play. So I'll explain further that one. So this therapeutic play is many children cannot talk about what is happening to them during illness because of fear or because their vocabulary is so limited. They cannot describe their feelings because play in the language of children. Children who have difficulty voicing their thoughts in words can often speak clearly through play. So let's proceed to energy release. Energy release, children release energy by pounding, hitting, running, punching, or shouting. Alam niyo naman mga bata, mo na ilahang mga pabadlong moments, pabadlong na mga ginahimo. Hitting, running, punching, or shouting. The overall goal is to maintain a sense of empowerment and self-efficacy during hospitalization. So, for the dramatic play is acting out an anxiety-producing situation. It is most effective with preschool children because they are at the peak of imagination, and also puppets of doctors, nurses, mothers, fathers, and children help young children express their feelings. Anatomically correct dolls are used also to help children describe their feelings about sexual maltreatment. So yes. So during that illness, the situation about which children need to express feelings or are illness related, and therefore the equipment needed for therapeutic play is common healthcare equipment such as what I said earlier: dolls, doll beds, play stethoscope, IV equipment, syringe, mask, and gun. So it is good to have a play session with a child near to the beginning of an illness to see whether the child communicates any fear about this experience through play, and also to gain the trust of the patient. And so you need to communicate with them. And lastly, creative play. Older school-age children and adolescents may not be interested in drawing but can be interested in making a list of procedures or experiences they like and dislike. So some children are too angry to be able to act on their feelings through dramatic play. However, they may be able to draw a picture that expresses the emotions or conveys the extent of the picture that expresses their emotions or conveys the extent of their knowledge. So I hope you like my video, and I hope you understand my report, and just let me know on your feed. Just let me know if hindi, kasi pwede nyo siyang ilagay sa feedback nyo para din malaman. And rest assured that I did my best in this report, and I hope guys that you learn something from my report. So that would be all. Thank you so much for listening. God bless everyone. Merry Christmas.